Welcome to Brandon Hall Group's Excellence at Work podcast. You will hear from industry leaders covering innovative, cutting-edge business, learning, and HR topics that weave current market research and technology into each episode. Our Excellence at Work podcast is hosted by Brandon Hall Group's Chief Operating Officer and Principal HCM Analyst, Rachel Cook.
Thank you for tuning in to Brandon Hall Group's Excellence at Work podcast. Don't forget to subscribe. And I'm excited to have with me today Andrew Lawrence, the VP of HR and EL and PD from SCL Health. Welcome, Andy.
Thank you, Rachel. It's good to be back.
Yes, I always enjoy chatting with you and getting some of your insights on what's happening at SCL Health. And today we're going to be talking about leadership or reinventing leadership in kind of today's world. So all good stuff to share, I'm sure. And just to orient our listeners in today a little bit about you and your background. Andy has over 30 years of corporate HR and organizational development experience in leadership, and having served for several Fortune 100 companies with interest in domestic and international air transportation, global energy service, broad-based consumer financial services, communications or telecommunications, and healthcare. Andy is passionate about human capital development and is a champion for organizational excellence. Currently, Andy is serving as the Vice President of Human Resources, Enterprise Learning, and Personal Development. Andy is eager to build relationships in support of both the mission and strategic priorities of SCL Health and its community partners. In support of SCL Health's Mission Forward 2025 strategic plan, Andy and his fellow learning and development community of practice colleagues at SCL Health have earned a reputation for continuous improvement and successful application of new and meaningful methods, practices, and resulting educational programs, and more. I could go on. You have a very impressive background, and in the work that you do at SCL is also very impressive. And that's why I'm so excited to have you here today to really kind of bring to light some of your ideas and innovations and point of view. Also, congratulations for winning 5 of Brandon Hall Group's Excellence Awards in 2021. Congratulations.
Yes, thank you very much. I have them over my shoulder, no less.
Oh, I love it.
Yeah.
That's fantastic. And so, as we look back at last year, and we're in April, going into May soon. What are some of the things or takeaways that you've had and kind of are incorporating into this year and the remaining part of this year?
Well, Rachel, that's a great question. It's something that I think as professionals we're all wrestling with as we try to move at the speed of business, so to speak. The last couple of years, nobody has to repeat what we've all been faced with. Some organizations, most including SCL Health, took a position that leadership development was non-essential, and non-essential from the standpoint of it wasn't the most urgent thing that was top of mind. We are very mission oriented. Our mission is just a part of our organizational DNA, and so our commitment to the care and nurturing of our vulnerable patients, the communities that we serve, are an integral part of what has guided the organization over the last couple of years. But as we begin to ascend from that work and the dreaded pandemic that has been impacting the globe, we rededicated ourselves to 2022 being the year of the leader. And one of the realizations is, as you make difficult business decisions, there are consequences and oftentimes there are rewards. And so we have made that commitment and are well into now, nearly entering into the second part of the middle part of the second quarter, and really begun to realize some of the things that we took away from 2021 and 2020 is just the importance of appealing to the individual. I was always told years ago that everyone has a sign over their head that says, "Make me feel special." And I think now is a time in both market and across the industry, tapping into what's important for the individual and aligning that with business requirements takes curation and it takes conversation. And so I believe that technologically, we have been so driven or electronic driven that now we need to be mobile driven. So one of the things that we are really dedicating ourselves to is looking at the different mobile forms of learning that can augment also that individual at the point of need. Nothing earth-shattering. I think a lot of people are thinking about these approaches, but in healthcare, there are tremendous demands, and oftentimes we have to maintain our focus on the regulatory, safety-oriented concerns. That's paramount to being able to offer quality education. But from a leadership perspective, we have to be just as diligent, just as vigilant in looking for creative approaches to meet the unique needs of our workforce.
And is that your main focus as far as your strategy and in shifting it to support the modern workforce is around
Yeah,
mobile?
yeah, it's definitely around mobile learning, and we still utilize traditional methods. One of the things that we were very deliberate about this year was introducing, it's a tried and true methodology of a 70-20-10 model, and really beginning to have conversation around the fact that only about 10%, give or take, of education really happens in the traditional parochial classroom, whether that classroom is now virtualized or it's still in person. Um, there's about 20% of the learning that is done through special projects and experiences and cohorts and things of that nature. But when you think about the largest volume of learning, and I think we're all exposed to this in various forms, whether it's the traditional periodical or the news article or the web article or the webinar, there is a vast amount of information and education that's underway that we oftentimes don't even realize is packaged as education. And so I think that that's part of the strategy, is creating something that almost doesn't even feel like education, but it really is. So we're
Mhm.
we're addressing a multitude of needs, and getting creative in the delivery of those solutions using digital formats.
Interesting. And that was an area too that we saw in our HCM outlook as we look at priorities, from the year looking into the next year and ahead. And so we, saw a lot of focus on digital and experiential and, leaders in general, developing leaders. And so what would your, how would you describe how you are selecting, developing, and promoting leaders?
From a selection and promotion and development perspective, we made a pact this year to move beyond the traditional leader of others, leader of self. We've expanded to and adopted a persona-based approach that includes the persona of leader of projects and programs, perhaps an individual contributor leader who has that coordination, accountability, and responsibility. Augmenting also beyond the leader of others to the leader of service lines, so that there's a combination of some of the other roles. And then leader of organizations. This is where we have begun to really tap into what the modern executive needs in terms of their growth and development. That ranges everywhere from traditional executive coaching to media training. There's so many more forms of media, both social and political and other forms, so that we have to be constantly aware of our brand, both personal and organizational, and ensuring that we're getting clear messages that are consumable. In terms of selection, we still rely very heavily and have reinvigorated our annual talent review. We have really been very concerted and reevaluated the traditional 9-box, reevaluated and redefined those 9 boxes in terms of promotability, being sensitive about terminology, being inclusive in our approach, making certain that we're challenging each other's conventional wisdom and conventional practice to ensure that we are genuinely bringing in as many perspectives as possible. And I think in the last couple of years, as we've been expanding that focus, this last year we went all the way down to our individual contributor managers. We had over 902 people participate in our annual talent review this year. And for the first time, frankly, in 9 years, we were able to get through all 902 individuals in terms of a meaningful dialogue at a leadership level, looking at decision quality, looking at how are they developing other leaders themselves, how do they show up, and how do others experience them. So it's a really kind of holistic approach to ensuring that we're growing and developing our team members, and then augmenting that this year in 2022 with a host of traditional classes to the inclusive cohort. We believe strongly that hardwiring the learning, that it's not just enough to go to a class or have a learning experience, but to practice. If there's one thing our training methodologies have taught us over the years, is that in the absence of practice, the skill will atrophy. And so we're really trying to put in creative approaches to practice, whether it's using the technology and things like Zoom and breakout groups and making those table activities, but also taking time to journal. Some of these traditional methods that we've used in the classroom translate quite well. There's a very little loss of fidelity. In fact, sometimes it becomes just a new, everything old is new again. So it's that opportunity to pivot and to reinvent.
Absolutely. Well, it sounds like you have a lot in place, and you're not transforming everything, but you're really kind of honing in on the important pieces and redefining them and those approaches and reflecting on what has worked. Some of the traditional is still coming back, never perhaps or anytime soon the way it was. However, there's still a need for it, but innovation and technology and virtual forums can be just as powerful. and we're on them all the time, and I feel like we're sitting together in the same room. And I was recently on a workshop too where we had the breakouts, and we went into separate rooms, and I didn't feel any different than if I was
Mhm.
in person. Perhaps maybe would have all gone out to lunch. So you may have that um, you know disadvantage perhaps, but you can make it up in other ways too, and there'll be time for those lunches as needed. And
Yeah,
do you feel that you had the resources in place to support some of your change, or was that a big shift for you?
I can say with all honesty, and I think I've mentioned this before, we have something very special in that we've had extraordinary support from our Office of the President, and our ministry leadership team. And even though, Rachel, with all honesty, we have uh, uh, completed a legal close around a merger
Mhm.
with extraordinary legacy organization. We are now both legacy organizations, as we refer to ourselves, and uh, that that commitment. What I see is the true existence of a learning culture. We have merged with Intermountain Healthcare, and we are forming the new Intermountain Healthcare. We get to retain
Exciting.
here a Catholicity, so our faith-based motivation retains, and so I think we're taking the lead that and the momentum that we've had as a mid-size Catholic health organization. Now we're combining our capabilities, and there is an extraordinary amount of excitement and enthusiasm about what the future has to hold. We made a commitment in 2021 during our revenue cycle, our planning cycle. There have been changes to the way we plan. We're more on a rolling forecast structure, so we have some different flexibility. It's another one of those cases where it's not wrong, it's just different. We have the opportunity to invest. We have done so. We have the largest single forecasted bundle of capital dollars to invest in leadership development programs, ranging from our frontline nursing leaders to our physician leaders who have uniquely different needs and experiences, and we need to be respectful. It goes back to that. Everybody has a sign over their head that says "Make me feel special," so we've tried to be thoughtful about
I
that.
like that.
But
I
then,
mean, I
I'm
said
sorry.
I like that tagline. Make me feel
Yeah,
special.
yeah. I mean, that's really what it's all about at the end of the day. I think when people feel a connection to the work that they're doing and they feel heard, so our associate engagement, caregiver engagement surveys are a wonderful source of validation and information. It's the the reality that in order to affect change, involve those who are most affected. And so we had done focus groups. We had sought feedback from leaders. And so while we have a focus and a plan that I
Mhm.
indicated is driven by personas. We have a lot of flexibility. We've even introduced the ability to sit down with cohorts or with individuals as well to map out a 12 to 18 month journey, so that it is a continuous process. Rome wasn't built in a day. It took 800 years to build and 800 years to fall apart. So, and don't quote me on the number of years, but it's the metaphor that makes the biggest impact. Um, it's a journey, and we've had extraordinary support. And I think that in the in the economic situation that we find ourselves in, um, the 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 war on talent, um, it is it is real. Everybody sees it, feels it, experiences it. We've
Yeah.
started to see turnover in places that we haven't seen turnover in a really long time. But that can be wonderful because that's opportunity for new beginning. And I think it's all in the way that we approach how to solve the problem.
Absolutely. And well, how would you describe or what attributes to a great leader today? Leadership, we're talking about reinventing leader development for the modern workforce, but how, what makes a great leader, especially today
Well,
more.
I probably would. I, I've been working on an ICF certification myself for coaching, and I think that coaching is grossly undersold.
Mhm.
One of the things that we learn in that journey um, is how to ask meaningful questions, how to ask questions that don't start necessarily with why, because that why puts people on the defensive. It's starting questions with what, it's who, how, unpack that for me, tell me more. And I can remember as a kid, I was always told, sometimes we were told little boys and little girls should be seen and not heard. The reality of it is we have two of these. We have one of these. We need to use these twice as much as we use this. And I think that in many respects is something that I'm learning and I think really does reflect um, a, a, a capable, thoughtful leader of the future, one that's able to pivot based on what they hear, respond in kind, offer alternative thought processes. I said it earlier, it's not wrong, it's different. Recognizing that in order for me to be right, someone else does not have to be wrong. And
Good
so, creating that psychological safety and being aware that the absence of self-awareness in our society is abject. It's overwhelming. And I
point.
think as leaders, if we can tap into that self-awareness and the awareness of our surrounding, we can create and motivate and move, and we can do so at the speed of business. That's what I look for.
All great stuff. And Andy, before we wrap up today, I would just like to leave everyone with your thoughts on what tools and technologies do you recommend that leaders need to support their workforce?
I think the tools come in so many different forms. There's
Mhm.
some good form of time management, and that extends into our personal time because we need to recognize. Remember, an ER nurse said to me one time, Andy, there's 8 hours, there's 24 hours in a day, 8 hours of work, 8 hours of sleep, and 8 hours of play. And um, and I, having deep respect for the stress of the ER environment, I think we can safely say that the stress of day-to-day existence for all
Mhm.
of us, whether we're ER um, team members or not, it's our own form of ER, and we've got to take the time necessary to plan our days, to think about what's reasonable and what's accomplishable, recognize that we have to balance our life. Work is part of our life. And so I think time management, awareness of our surroundings, awareness of our emotional and psychological and mental state. If there's one thing we are probably um, uh, facing is the need for um, having a really healthy way to um, exhibit our behaviors. Um, and hopefully we show up in a healthy way. But when we don't, we need to read the signs. It's a fascinating thing from my perspective. I guess I'm a people watcher, and there's times I know myself. I know when I've burnt the candle at both ends, and
Mhm.
so those are the things, the pivoting, the ability to be resilient, finding the resolve ourselves to make certain that we're managing our time and staying healthy. Um,
Mhm.
if we're not healthy, we're not able to help others. And I think that that is probably the message that I would advocate. Take care of yourself, take care of others.
Mhm. And now there's a lot more resources too that leaders can use to make available to their workforce,
Yes,
regard to mental health and um, wellness. So there's a lot more resources out there than ever before, and I think they've become more acceptable for for
very
either
much so.
managers to recommend or for employees to take advantage of.
Yeah,
And
it
I
goes so much further than just an employee assistance program now. It's different ways that we can practice healthy eating habits, sleeping habits, uh, just and so much of it is mobile,
yeah
and that kind of brings us back full circle. It's reinventing um, our our approach to work, because work is part of life. They used to call it work-life balance. It's life. It's just life.
it's fluid.
It is.
Thank you, Andy. Thank you for being part of our executive series on our podcast, our Excellence at Work podcast. So it was a lot of fun, and I really enjoyed chatting with you today, as always. And so we'll have to do it again soon. Take care.
Thank you, Rachel. It's always a pleasure.